Congratulations, all mother and father to be, and welcome to my series of Bump to Cradle. Well, you must be wondering that why I have written so many tests on your first prescription and why it is so important to do all those tests. So this video will explain the battery of tests which I have written, what is the importance of all those tests. So starting with the first test, which is the blood group. So we must know the blood group of the mother. The importance is, first, if the mother develops anemia or bleeding during pregnancy, we should be prepared with the proper blood group whatever she is having. So we must be prepared with that. And the second thing is that if she is having a negative blood group, we must know the blood group of her husband also, because if the mother is having a negative blood group and her partner is having a positive blood group, there is a chance of RH incompatibility during pregnancy, and we have to do further testing by indirect Coombs test. We have to give anti-D, which I will be telling in later on videos about these things. So it's very important to do the blood group of the mother. If you have the blood group report from the very beginning, you can carry those report also, but make sure that you keep it in your pregnancy file from the very beginning, so that to avoid the confusion at the time of delivery. The second, coming to a test which is HPLC, it is the hemoglobin electrophoresis, which we do to rule out the diseases like thalassemia, sickle cell, or any other hemoglobinopathy. Now, what is this test? These are actually some genetic condition in which there is a defect in the formation of hemoglobin in the mother's body. So, if a mother is thalassemia carrier, if it turns out to be thalassemia carrier, then we have to again test her partner also, because if both mother and the father are thalassemia carrier, then we have to be aware that there is 25% chance that a baby can have a thalassemia disease. So it's very important to screen thalassemia in the pregnancy period. The third test which I have written is a blood sugar testing. Now, why it is important? Because we have to see if the mother is having overt diabetes or not, because if the sugar is uncontrolled during pregnancy, it can lead to abortion and even congenital problems in the baby. The next test is a thyroid testing. Now, many Indian women are actually hypothyroid, and the demand of thyroid is also more in pregnancy. The reference range is also different in pregnancy, so we really need to see the TSH level in the first trimester. Usually we tell in non-pregnant that the TSH, if it is less than 5, it is in the normal range, but in pregnancy the values are certainly different. In first trimester your TSH should be less than 2.5, whereas in second and third trimester the TSH level should be less than 3. The other test is a serological the serology which we test to rule out if the woman is having, she's seropositive, like she is carrying HIV or hepatitis B, hepatitis C, or any other diseases, venereal diseases like syphilis or not, because this is very important to screen out and to decide the further course of management in the pregnancy. Apart from that, we also test for routine and microscopic examination of urine to see if the woman is having any urinary tract infection or not, because it is very common in pregnancy that women can have asymptomatic bacteria, and it's very important to treat that also, because it can lead to abortion and even preterm labor in women. Following that, I have also given one test which is an ultrasound. Preferably first can be tell to do a transvaginal sonography, because that is more sensitive than ultrasonography in diagnosis of the early pregnancy, and not only the gestational age, but we want to ascertain what is the location of the pregnancy, if there is any chance of ectopic pregnancy, whether there is any molar pregnancy or not. So by dating scan, we are able to ascertain what is the type of the pregnancy and the location of the pregnancy. Now, a very common question asked by patient is that I have done a urine pregnancy test at home and it has turned out to be positive because there are 2 lines in it. So is there any way to confirm it? Yes, you can do a blood test. It is serum beta HCG, but mind it, one serum beta HCG is not something which we are looking for. Okay, so if you are doing a serum beta HCG, we always tell to repeat the serum beta HCG after 48 to 72 hours to see whether it is doubling or not. Because if the beta HCG is doubling, it denotes that the location of the pregnancy is possibly in the uterus and it is going to be a viable pregnancy. But if the beta HCG is not doubling in that time, so we have to be very cautious and we have to rule out if it is going to be an abortion or is there any risk of ectopic or not. So yes, you can undergo beta HCG test, but for all practical purposes, unless otherwise proved, we take that the urine pregnancy test to be positive and we do a scan to confirm the location and the viability of the pregnancy. So these are the tests which you have to undergo. Now apart from that, if you have any other chronic conditions, you can feel free to tell me so that we can investigate you further regarding all your chronic medical problems. So I hope you find this video to be helpful to you, and that's it. If you have any doubt, just feel free to call me or my assistant. Thank you.